I lived with someone for years who thought they had POTS and EDS, and it turns out they did. And now they have formal diagnoses from some of the best specialists in the country for that stuff. And we're 100% validated at what they learned through self-education. Now I'm an advocate for them and helping through all of the medical system process. And here's everything that I wish I knew when we started this process 7 years ago. I am not a medical professional, and this is not medical advice. Always seek out, consult a medical professional. Lesson 1, if you think you have it, you probably have it. My partner thought they had it, and they did have it. Don't let people gaslight you into thinking you can't self-diagnose. You know yourself better than anyone. Throughout this entire process, most of the specialists we've encountered, or a good portion of them, literally became specialists so they can treat themselves or someone they cared about. These people literally self-diagnosed and did the whole 10 years of school just to get treatment. Unfortunately, that is how grim it is. That's what it took. So bless up, we have the technology and resources now for community to share our experiences with each other and to educate ourselves. And now blessed with AI tools like GPT-5 literally outperforms medical professionals across the board in testing. You are valid. Lesson 2, the medical system is not there to help you. I wish I knew this from the start. I thought somewhere along the way, someone would care and someone would actually be trying to treat me, diagnose me or treat me, and completely remove this idea from your mind 100%. If you want to get diagnosed and treated, you cannot get emotionally involved. If you feel frustrated and let down from being underdiagnosed, all that's going to do is completely hold you back. You have to approach it like, who am I going to find who's going to diagnose me? Who am I going to find that's going to treat me? How can I leverage myself and advocate for myself to get what I need? Lesson 3, strategy. So documentation, up to you to create a patient summary. That's like a little 2 or 3 sheet page that's got like your driver's license, your health insurance, your diagnoses with the name of what doctor who treated them, the name of your primary care if you have one, and their number, your preferred pharmacy, their number, their address, their store number. And if you have any diagnoses, list them, and then which doctor diagnosed you and on what date. You have to, it's really hard to do, but you have to get your hands on all imaging you've had done. If you didn't already do this, it's going to be really hard to go back and get it. I was able to do that. It took me a lot of hours, but I managed to hunt down a lot of my partner's old imaging. There's a few ways to do this. Let's say you go get an MRI and they're like, all right, thanks. And you leave and they're like, we'll send you the results. Never let them do this. They got to give it to you. So I will not leave until I get it. And the CD is good, but I always fight to get the raw data for the files. You won't be able to read them, right? The best way to get it is by using their business to business file sharing system. There's lots of different ones. PowerShare is really good. It's called Nuance PowerShare. Business to business cloud sharing is how medical facilities share imaging with each other. You can set up a patient portal and actually have them give you the imaging through there. So I did that and got a lot of imaging that way, or I otherwise could not have gotten it. I actually will fully download the file onto my phone or computer on the cloud before I leave the place, or get a physical CD. The CD is actually really important, so you need to make sure you have that. And then all imaging you've had done, it has to be accessible for the doctors. So I will literally go print images of it, color prints, and put it all in a folder. I'll only print out the images if they're really relevant in a specific way. If you have some really crazy thing on your neck or spine that's really obvious, definitely print that out and include it in your patient summary. But otherwise, just make sure you have everything accessible for the doctors on a program like Nuance PowerShare. Radiologists are almost always wrong. So it's rare to get a radiologist that's actually going to see what's wrong and diagnose it. They're also scared for legal reasons to make any diagnoses. So it's really hard to find a radiologist who will actually say something. They just protect themselves like that. Don't let that radiologist report bum you out. It's all about taking your imaging to someone who's specialized in that and will actually be able to look at it. This is a really common problem. One hEDS specialist I spoke with said she almost never sees them do a report correctly. It's It's profoundly common. It's 10% of the time they might actually see and diagnose a problem. This is why you have to get the imaging yourself and bring it to the right people. Lesson 4, what state you live in matters big time. You know how some people who need a certain procedure done and they can't get it, they'll go drive to a different state and get it done there? That is the perfect example of how serious it is when I say what state matters. Every state has different laws, and that makes a huge difference. In Indiana, they have basically the right to refuse. Pretty much any medical professional can refuse to treat you for any reason. In California, they actually can't do that. They still get away with it 99% of the time because people don't know better, but you actually have legal protection there for that. And that matters. That's actually been the reason why I've been able to get, as a medical advocate, that's how I've been able to get the patient that I'm helping treatment. I actually will print out the California state code and bring it with me to appointments. And a lot of times I'll set up an appointment and they'll be like, oh, your insurance doesn't cover this. I can't see you. Click. Well, then I'll fax them and be like, under state law, you can't refuse treatment just because they don't accept your specific insurance, blah, blah, blah. And usually when I fax them, they'll call back within the hour and set up the appointment. When I was at the hospital, it was 10 times harder, but I was fighting them every step of the way. And usually I had to cite legal work. Sometimes they'll battle me head to head and they won't even give an inch and they'll leave. But then after they leave, they'll start sending in people for the care. So sometimes they won't even give you the satisfaction of being like, okay, well, I'll take a look at this. They'll just tell you, you got to get out or we're discharging you. As far as Medicaid goes, it works like this. You have HMO and PPO. HMO means you have a primary care and you have to have your primary care oversee all of your treatment. That person only deals with in-network people who work with your insurance. And they basically, if you need anything done, it has to happen through the primary care. The patient I'm helping has Medicaid, and I am constantly on the phone with their doctor, and their doctor is the one who's coordinating everything. When you have a PPO, that is private, and you can pretty much go wherever. That's the more fancy, more expensive health insurance. And then there's also an MCO, but it's the same as. And if you see MCO, that's just also an HMO. It's the same thing. It's just Medicaid or something like that. And somewhere like Indiana, if you are on Medicaid or something, you're basically screwed. Like I said, the best thing you can do is just leave the state because getting care there is almost impossible unless you're rich and then you can just pay cash for everything. But in California, you can actually get care because of these legal protections. If it's an emergency, you can do all this stuff like I do, where I fax them. I'm like, hey, this is an emergency. Legally, you have to see the patient, etc. So that's the difference between getting care in California versus Indiana. Oh, and in California, this is important. In California, you can still pay cash to see a doctor while still being on Medicaid. In Indiana, you can't do that. Like I said, it's a weird thing with the law. So a lot of hEDS specialists, almost all of them are cash only for the most part, unfortunately. And if you're already on a different health insurance plan, they won't let you see them, basically. So in Indiana, you can't pay cash and also use your health insurance, but in California, you can. So it's a pretty big difference. Okay, lesson 5. This is just a survival plan. That's if you think you have POTS or EDS, the first step is just getting a diagnosis. And the cheapest and best way to do that is EDS.clinic, setting up a telehealth appointment. And then the reason for the visit, you just say hEDS diagnoses. Most of their people can diagnose via telehealth. I would prioritize getting a rheumatologist if possible, because a rheumatologist will always be legally more defensible as you get a proper diagnosis. Because every step of the way throughout your care over the rest of your life is going to be fighting with every single person. Like I said, never feel like anyone's there to help you. It's nonstop advocating. You always walk in with your patient summary, with your list of doctors, with your list of diagnoses, and it's always like that. You have to fight for care every step of the way. Oh, and don't think doctors know anything. For the most part, I was horrified every step of the way. When it comes to hEDS, they call it a rare disease. Once you start trying to go get seen anywhere, you really realize how rare it is. So for the last few months, we've only been seeing specialists, and when we finally ended up having to go to the hospital because the patient I'm helping had a CSF leak that was so bad, we had to go to the hospital. Every single doctor and nurse and everyone had never heard of hEDS. None of them. So it's pretty scary how, or MCAS. So it's pretty scary how uninformed doctors are. So never expect them to. Lesson 5 is this is the cheapest, best survival plan for you if you're a poor person. So it's just getting that diagnosis through EDS Clinic. I think it's $300 or $400 to make an appointment. So you're going to need that diagnosis first. And then after that, it's about finding, hopefully the person you see there can kind of stay with you and you can keep seeing them and they can send off referrals and start getting you care. hEDS is a very tragic diagnosis. It's not curable, and it's just going to be a lot of pain management and stuff for the rest of your life. Underdiagnosis is such a thing. If you don't get diagnosed till later in life, it's a whole list of stuff you're playing catch up with. So really the goal is to get functional. So if you can get in with a pain management doctor, that's going to help you with getting a medication plan to get you through your day to day. That's really step 1. The other steps are like, do you have a CSF leak? Because that's really common. Because if you do, you got to get that taken care of, because CSF leak ruins your life. You can't function with cerebrospinal fluid linking. You get brain fog, it has so many other problems, and it leads to much, much worse. I guess I would just consider moving somewhere where they have Medicaid and they have doctors, and then living a life that is so that you can get on Medicaid and getting that care, and then fighting nonstop along the way to try to get care, which is what we've been doing basically. We ended up so poor because of the health complications. You basically just spend every day just trying to survive. You're paying cash to get a diagnosis. You're trying to get on pain management, medication management, so you can function your day to day. And then you're trying to get CSF leak diagnosed and treated, which is, they usually can figure that out with an MRI, hopefully. And CSF leaks, there's 2 types. There's cranial and then there's cervical. Almost every doctor diagnoses and treats cervical CSF leak. So if your CSF leak is more in your brain, it's up higher around your neck, then almost everyone who diagnoses and treats CSF leaks aren't qualified or are going to say you don't have one, because they only look at the cervical one. So you always have to check. Are they looking at cervical or cranial? And if you go in and they check for CSF leak and say that you don't have one, you have to actually ask them to update their clinician notes to say, we just ruled out a cervical CSF leak. Further testing is needed to investigate a cranial CSF leak. Lesson number 6 is it's not just genetic. So you can develop hEDS from long COVID. You can develop it from a chronic environmental irritant exposure. It's no coincidence that Indiana is the epicenter of EDS cases, and it's no coincidence that's why it was one of the first places to have doctors specializing in that. And that's actually, EDS Clinic is a startup, and it's the son of a doctor who was an hEDS specialist doctor. And when he retired his practice, the girls had nowhere to go, and all of these new girls were coming in constantly with, hEDS, and there's no way for them to get diagnosed. But the dude retired, right? This startup is just focused on getting people hEDS diagnoses. So why are there so many young women in Indiana with hEDS? Well, it's no coincidence. So it's called Pentad Super Syndrome. There's a paper on this. It's the spiky leaky theory paper. And I actually have a YouTube video that I just summarized the paper that makes it really easy to understand. It's really important to understand it's not just hEDS. It's hEDS, MCAS, it's POTS. They're CSF leaks. They're all connected. And the root of it all is MCAS, and you develop MCAS from being exposed to an environmental irritant. So if you have Roundup in your drinking water from an early age, it's no coincidence you end up developing MCAS. And the MCAS is what goes on to ruin your life, basically. It makes your body develop all wrong. You don't have enough collagen in your body, you get hEDS. And then the longer you go undiagnosed, the worse and worse and worse the symptoms get. So in Indiana, 46% of Indiana's total land area by square foot is occupied by Roundup Ready corn and beans. Anywhere, at least 100 million gallons of Roundup is sprayed onto the ground every year in Indiana. Every single year, over 100 million gallons of Roundup spray is put into the soil in Indiana. So where I grew up, we had well water, and we shared next door was a cornfield. So, you have all these plots of land and farms and stuff, but they all share the same water reservoir underground. And when you just have these fields and it's all just dirt underneath, all of that stuff just goes directly into the underground water supply. So I was drinking Roundup contaminated water my whole life. And all over Indiana, this is the case with nitrates too. If you need anyone to understand how true this is, just research blue baby syndrome in Indiana. That's just nitrates, fertilizer. That's not even Roundup. So that was a problem before Roundup was even invented. That'll just put it in perspective. So you have this chronic environmental exposure to an irritant, and then your body develops MCAS, and the MCAS wreaks havoc on your system your whole life. And it's all this irreversible damage, basically. Step one is just being genetically vulnerable. So that's why it's not every person that gets it. You have to already kind of have weaker genes from maybe your parent or grandparent had some environmental toxin exposure that led to being predisposed towards developing MCAS. Why does this matter? Because if you get a genetic test done, it doesn't mean you don't have it. So we had a $3,000 in vitae LabCorp genetic test done, and it didn't show positive for anything, which is really weird because the patient I'm helping definitely has a vascular EDS. And we were, what the heck? It was really kind of a devastating blow because we were so sure. Well, that was before I learned about Pentad Super Syndrome. And so don't let that mess with you, basically. It's great. If it is genetic, you can prove it with the genetic test, maybe. Also, genetic tests aren't just black or white. If you're going to be genetically testing someone and you're looking for connective tissue disorders, you can't just look at it and whether someone has it or not. It's not black or white. Genetic testing is way more complicated than that. You need to know the patient's history, the symptoms they're having, their family history. They need to be coordinating with your physician. So they need to be talking with another doctor and coordinating this test, and so that the team knows what to look for, because it's way more complicated than just checking if a certain gene is a different number or not. That's not how it works. And unfortunately, genetic testing is a really big tech startup thing because it's basically just data science. It's all just spreadsheets at the end of the day. So all of the best genetic doctors, there was this guy that was in LA that got picked up by the Super Corp, and now he works for this genetic testing company that's really good that we can't afford because it's like $5,000 to get a test done. So if you can afford it and go get the testing done from that guy, and you can spend the $5,000 on it, then that's awesome. So basically, living with hEDS and the Pentad Super Syndrome is all about becoming a millionaire. You got to make $1 million a year to pay for all the stuff you need, full stop. And that's why I'm here making content. Our whole life path changed because I was like, okay, the only way this works for us to have a good quality of life and be able to continue working together and stuff is to become really successful influencers and have a creator startup business. It's because that's just what it's going to take, because if you have a lot of money, then you can have a decent quality of life, because what you need to continue treatment is regular physical therapy, regular kinesiologist visits for adjusting your subluxations, putting your stuff back, a hardcore medication management regimen. You need so many meds. People with hEDS need a crazy amount of meds. I mean, you need more meds than what seems even possible for the pain management, because if you think you have it, you are so valid, because it's one of the most painful, brutal things to live with in the world. No joke. It's when we finally got diagnoses, like when the patient I'm helping finally got a diagnosis, everyone was, whoa. When they finally get the paperwork, you know what I'm saying, and the treatment, they're always just, this is crazy. You know what I'm saying? They know how serious it is. And so you'll see these patients getting the most insane mountains of meds because they're just trying to get through their day-to-day. Lesson 7, insurance automatically denies everything. Every treatment you ask for, every referral, every procedure, the first thing they do is just automatically deny, because that's their business. That's how they make money. The less things they pay for, the more money they make. It's simple math. So just count on them automatically denying it and be prepared to appeal. I have an app called Fax Burner. It lets me fax. And on my phone, I just take a photo. So I do have a regular printer. I'll print out, I'll type a thing up in Google Docs. I'll fax them the appeal stuff, Lesson 7. AI tools are champions of the poor. We've never had so much access to knowledge and resources as we do in this moment. It's a completely incredible thing. It's true because people who are in power invest a lot of time and energy into keeping people from accessing it. So there's a lot of propaganda about every time you do a chat GPT prompt that it uses this many bottles of water. There's a lot of this keeping kids only allowed on their phones for so many hours a day kind of stuff. A lot of this is just anyone who's ever invested into the rural school system, the public schooling system, and keeping people undereducated. That same infrastructure is super invested in keeping, poor people from using AI tools because they're really useful. So AI tools will change your life. You really, really need one. I recommend you getting ChatGPT and paying for it so you have the full memory so you can train it. So I would use chat and fully train it on all your stuff. The only thing is be careful with certain information. I wouldn't upload a medical document that had your phone number or your home address or any sensitive data like that, because anything that you type into ChatGPT technically potentially could get accessed by the internet. So just keep that in mind. Be a little bit careful about that because it's easy for that stuff to get leaked online, your conversations with chat. But even with that added risk, it's 100% worth it to use it because of what you get in return. So I would just pay for chat and train it on everything. Tell it all of your history, as much info, the more info you can give it, the better it can treat you. When you're actually trying to do appeals with insurance, this is where AI tools are really important. Grok is really good at legal, and use all of them. I use Gemini chat. I use Gemini deep research for trying to find doctors who are hEDS specialists. So I would use every tool possible. Appealing insurance denials, that's where you need AI tools to type up a form, figure out exactly what you need to say, how you got to do it. Listen, this one's really important. How to live. So you will never find support and community if you aren't actively putting yourself out there. So really, I think the most important thing you can do to get your self-help and to get support and to get opportunities and resources is to learn how to face things head on and just post every day. If you can start literally posting content every day, and even though it really sucks and it's really scary and you don't have the energy to because you're sick, you're so sick, but a lot of people feel really hopeless, and for good reason. I wish I could be like, hey, keep your head up, things will get better. That's not the kind of person I am. Like, it's one of the worst conditions in the world, and it's unreal how bad it is. And this is why I'm doing this. This is why I do what I do. But what I will say is that social media can change your life. And a lot of the opportunities we have gotten are from just posting. So if you don't post, nothing's going to happen. And post, not perfect, right? So that means it's better to post than it is to not post, even if your posts are bad. Because by actively putting yourself out there, you're going to connect with people. They're going to share resources. You're going to get opportunities. I really think I'm a really big advocate, and that is the most important thing to do, because if you're just sick and you're just stuck laying in bed for weeks at a time, which is what happens, and you get so isolated and you get feeling so down. And I would say morale is probably your number one most important thing as far as your getting care goes and treatment. Morale is, never underestimate how important morale is. And one thing that will really help with that is, I said, is just posting nonstop. You know what I'm saying? The more public you are, the more you post, the more you talk about it, the more you engage with people, the more opportunities you're going to have. Lesson 9, you'll get back what you put out there. So as much as everyone needs the support and help from the community and care, there's this really nasty trap that happens to a lot of people, especially in the Midwest, where you're so unwell and you feel so bad and everyone's so mean and you're so underdiagnosed all the time. That affects you, but you end up getting back what you're putting out there. So especially if you're trying to get treated, you're going through the system, and if you need more kindness, you need more support, you need more friends, you need more of that, this or that, It's important to just remember that you'll never get a lot of love and support and help if you are feeling frustrated with everyone around you or putting that out there. It's like, okay, when I'm positivity, I'm just like, hey, how's it going? Or I'll be, hello. Someone who would have just been not even engaged with me before, a lot of times will come back and be like, oh, hey, how you feel is valid. And everyone should be there to support you and be nice to you. This is just a hack basically for curbing the odds in your favor for when you need more support and need more love. It's putting out the positivity will actually bring it back 4x. Whereas if you weren't posting at all, there's nothing's going to come back. The last thing anyone who has EDS and feels sick needs is for someone to tell them how to act. And because all you need is people to be nice to you desperately. This is not that. I just worry about the young scratchers out there, the young tattoo artists who are alone and trying to hustle up and try to come up in the Midwest, and all these young people out there who don't have an advocate and get isolated. I just think about them, and it's really more about, I'm trying to give growth hacks, how to cheat the odds in your favor. Lesson number 10 is that the longer stuff goes untreated, the more serious the symptoms get. And underdiagnosis is what it's called. That's when you get gaslit, when no one believes you, no one understands. That's when you try to eat food and it makes you sick, and then your family is like, you need to eat this, you need to quit screwing us over, or you're too tired, you can't make it to an event, and people, how could you do this to us, but you were just sick. All of that stuff, all of the people not understanding, the gaslighting, the invalidation, the underdiag. And then with medical professionals, when you go to get treated and they're just, oh no, you just have anxiety, or they'll literally lock you up. That's called underdiagnosis. And underdiagnosis is really, really serious and leads to a lot of really, really bad conditions that could have been prevented. The earlier you start mitigating your symptoms and getting treatment, the better. You finally don't get a diagnosis till way later in life. There's so much irreversible damage that could have been prevented, and that sucks. Trust yourself. Even if every single person doesn't believe you, even if, including your family, your friends, and your local community, or even online, right? If you know yourself, and like I said, there's a lot of incredible, sophisticated tools for us to educate ourselves now. And if you think you have it, you probably do. You have a lot of, resources to figure that out. Don't give up, I guess, is my last lesson, is that the earlier you start mitigating symptoms, the better. And there is a lot of stuff that can really help improve quality of life. There is opportunities right now to work remote, is what I'm getting at. For people who are isolated in rural areas, we actually have the biggest opportunity that we've ever had, and the ability to actually be a creator and do stuff online. You can be a curator. You can do all this stuff now that was never an option before. So I just want to say it's not totally hopeless. It's impossibly hard to get through, but it's not hopeless. There's a lot of opportunities out there. And so really a lot of the future is just trying to generate opportunities. You're trying to farm opportunities. So you're going to do this, do that, post a lot, engage a lot, do this, do that. You're basically trying to just make something happen. Because otherwise, I think out of the Midwest till I was in my mid-30s, it felt so hopeless the whole time. And it's good to know that it's possible to get out. It's possible to get treatment. It's possible to have a decent quality of life. Also, a lot of specialists we went to go see, even if they couldn't do the thing we were hoping they could do, always generated more knowledge. We always walked away from every appointment with knowing something new and important, with getting more information, with learning about more stuff. Even if we went and seen a specialist and it wasn't what we wanted it to be, we've always walked away with important knowledge. And that's the power of finding the right person. I would literally hunt and go to listen to podcasts and try to look up the names of all the doctors on these research studies. And that's kind of how I do it. I read research, read journals on this stuff, and look up the names of all the doctors and listen to all the podcasts I can about EDS and stuff like that, and look up the name of all the professionals. There's a lot of people on Substack now. There's a lot of doctors doing research on Instagram. Finding and connecting with those people to get your care. You are valid. And I'm sorry going through this. This stuff is crazy brutal. We put together some resources. So I'm going to link those in the description below. Books on EDS, research papers. I made a handbook for a family. When you do get diagnosed, I made a little handbook that is I spent a lot of time on it, but basically it just explains to family how they can be supportive. It's a little rough. I just got started on it, but hopefully it helps. I hope this helps.